I will invite Canadian Association of Optometrists, Monsieur Couillard, I believe. Go ahead, please. 5 minutes, sir.
Thank you very much, Mr. Chair. Good morning. Thank you to all the members of the House of Commons Standing Committee on Health, in particular Luc Thériault, the member for Montcalm, for the opportunity to present on behalf of the Canadian Association of Optometrists. My name is Dr. Michael Nelson, and I'm the president of the association. I'm also a practicing optometrist in Winnipeg, Manitoba, and I'm joined by Francois Couillard, our CEO, and Laurel Crabbe-Lauren, our senior manager of government and stakeholder relations. The Canadian Association of Optometrists represents over 5,400 optometrists who serve as Canada's primary eye care doctors. Our experience during the COVID-19 pandemic has been an increase in patients complaining of a variety of vision problems. Canadians are realizing the importance of their vision and that they should not be taking it for granted. Optometrists are seeing higher rates of eye fatigue, increased incidence of disease, and a growing rate of myopia. And conditions like diabetic retinopathy, which can lead to vision loss, have worsened as some Canadians chose to delay their routine eye exams. The growing myopia rate is especially alarming for optometrists and should raise a flag for government. Last year, the World Health Organization's inaugural World Report on Vision included some startling findings. Now listen to this. The rate of myopia is expected to rise from 28% in 2010 to 50% by 2050. Now, this is very alarming as myopia increases the risk of glaucoma, retinal detachments, and vision loss in adults. And while heredity plays a large part in myopia, it is further exacerbated by what we have seen through the COVID-19 pandemic, with more and more kind of near and close time and not enough outdoor time. And this is especially worrisome for children because of the increased screen time for school and recreational activities. Now, for those living with diabetic retinopathy, a condition that is particularly predominant in Indigenous populations, the problems of accessing care during the pandemic have resulted in worsening eye health.
Certaines questions de politique de haut niveau.
Some high-level policy questions merit the attention of the federal government. They will have a major impact on not only the health of Canadians, but also on the economy and the productivity of our nation. A Deloitte Access Economics research paper released last month estimated that the total financial and economic cost of vision loss in Canada was $15.6 billion in 2019. This was before the COVID-19 pandemic. The lack of a coordinated system of primary eye health and vision care was especially apparent during the COVID-19 pandemic, which dramatically reduced the ability of optometrists to provide care to Canadians. Vision issues touch all Canadians, with 6 in 10 report having had a vision problem. On an annual basis, almost 1 million Canadians miss work or school or have their performance affected because of vision problems. We would encourage you to support a vision study at the Standing Committee on Health once this pandemic is over. For some reason, Canada's many healthcare systems do not acknowledge that our eyes warrant the same level of care as other body parts. However, eye health and access to proper vision care for all population needs to be more of a priority. We have an opportunity to ensure that comprehensive eye health and vision care be included as an integral component of healthcare delivery from birth. 75% of vision loss can be treated or prevented, which means that early detection and treatment can improve population health and help circumvent costlier treatment and intervention in the future. Thank you very much for your attention.